Hi, welcome to Straight Ahead. This is Chris Faddis, the president of Solidarity HealthShare. Hopefully by now you've had a chance to watch our video with Katie Talento, which we shot earlier this year, to talk about healthcare and policy in America. Katie Talento was a senior policy advisor to President Trump on healthcare and has a lot of knowledge to offer. So please look for that video. In addition to that series, we are also offering a live series of Straight Ahead, which is more current events and topics related to transparency and healthcare that happened today. So today I'm excited to launch that series with my good friend and one of the co-founders of Solidarity HealthShare, Brad Hahn, who's the CEO of Solidarity HealthShare. And in this time when so many of us are at home and going through just some interesting changes in our lives, there's still a lot to talk about when it comes to healthcare, price transparency, and really how we handle this kind of crisis like the COVID crisis, but also how do we deal with these healthcare issues ongoing. So I'm excited to have this conversation with Brad. So Brad, welcome to Straight Ahead. It's good to see you.
Yes, good to see you.
How are you holding up with the coronavirus and the corona, as they say?
The Wahoo virus, we're just going day to day.
Oh, okay. Now, do you have your mask handy? I was worried about you being out and about without your mask. I know you're getting close to the age, Okay, good. So you got your mask. Okay, good.
We're ready to go.
All right. So. Well, it's been really just a crazy time and a lot going on, and I know you've been really involved in a lot of conversations with other healthcare sharing ministries as well as other policymakers, not only about coronavirus and about some policy issues there, but also just in general on how we continue to fix healthcare. So I wanted to ask you before we go any further into the price transparency conversation, what do you think that our members and others out there need to do today to protect themselves from any sort of price gouging or any craziness with the healthcare systems related to coronavirus?
Well, the first thing with the coronavirus is under the CARES Act, there was a $100 billion package that went to bail out the hospital systems. And with that money that was going to be used out of the $100 billion, if they have a COVID-19 case, there was some stipulation in the funding of that regulation that said that the hospital system could only bill Medicare rates because the federal government's paying for it, number one. And then number two, they could not balance bill or send a bill off to the person who was receiving treatment. So to me, this basically just locked in the COVID-19 prices for the hospital system. Now that comes up with another couple issues. Number one is, if you're at a hospital that received the COVID-19 funding, there's no published record on that, who that is. So maybe that's something you have to do when you start paying for your COVID-19 symptoms. But we also see a spinoff of that as well. The spinoff is these hospital systems now have an incentive to diagnose more and more people with COVID-19 so they can get more federal funding.
So Brad, with all that being said, how do we protect the cash pay and self-pay patients from any sort of price gouging or overbilling related to COVID-19?
The first thing is we have to really, as a consumer of healthcare, we have to demand transparency in billing. And so a lot of people and a lot of our members too need more help in how to address those issues. What we've taken proactive steps here at Solidarity HealthShare is we've been working with the key liaison of the COVID-19 response at the White House, who's an employee of Health and Human Services. We've been working with them to try to put more conditions upon that COVID-19 funding, the $100 billion funding that we went through the CARES Act. And what we were trying to put out and keep mindful of is that if you are a self-pay, cash pay patient, it should be the same rules that apply to COVID-19 funding. So that was the first issue we did. Now, why do we have to be a bit concerned about this now? Well, the big concern that I have is you have to look at how the hospital systems make revenue or create revenue in their hospital. So the first number one is usually elective procedures. So you go get knee replacement surgery, you have hip replacement surgery, a surgeon for any kind of ailment like that, and you go to the hospital. That's the number one source of revenue for hospitals right now. And you're taking that away now because these elective surgeries through these government executive orders by the governor of all these states have banned elective surgeries. So now you have to look at the number two revenue producing is the ICU beds. Out here in Arizona, we've been seeing that the ICU beds just don't have the occupancy as they usually do anymore. So they were really trying to clear the ICU beds to get more people for COVID-19. As of last week, the hospital beds here with the ICU beds and emergency room beds were only at about 18% capacity. So now the question is, how are these hospital systems going to make up this lost revenue? I think a very right place to make up the revenue is for cash pay, self-pay, non-COVID patients. And so what happens is that somebody who's a self-pay, cash pay patient has to go to the emergency room for non-COVID-19. that's the best place to egregiously overbill the members of society. So that's what we've been watching for. We haven't seen these practices implemented of overbilling yet, but we have people watching that right now and ready to have Health and Human Services to respond if this does become an issue for us.
Yeah, I think it's really important. Obviously there are there are many in the healthcare world that are actually hurting, especially private physicians, private practices, surgical centers, specialists who are now seeing their volume drop. They've been stopped, a lot of non-essential services have stopped. But what we're not really seeing as any help towards them. It's all going towards these major healthcare systems who also, they're certainly losing some revenue because they've stopped those procedures. But how do we make sure? And I think it's been great that you've been on top of this and been talking to the right people to make sure that that's not made up on the back end on Joe America who's just trying to get by, or members of healthcare sharing ministries like our members who are considered self-pay patients. So I'm really grateful that you've been able to help lead the effort there. And
that's the kind of trend we've been seeing, Chris. We've talked about this before, is before the COVID-19 crisis hit, we saw kind of almost these big bureaucratic hospital system, many of them not-for-profit, which is another half hour we could talk about.
Right.
That. These not-for-profit, for-profit hospital models, they've been gobbling up these little small, doctor practices, outpatient surgical centers, bringing them into this huge bureaucracy because it's a great source of downline revenue for them, right? And so then now you have to look at it, who's in the best position to weather a financial storm like the COVID-19 has produced. Well, these big hospital systems, even though they're laying off, furloughing people, they're still in the money they receive from the federal government. They're in a better financial position than the average small practitioner.
Right.
So these average practitioners, that's who we really need to be protecting. Otherwise, we're going to wake up someday and we're going to have all of our best doctors from the small practices working for these major hospital systems, where we see a lot of the egregious overbilling of medical care.
Yeah, I saw a stat today, and I don't know if it's totally true, but that there's only about 30 to 40% of physicians' practices are private anymore. So there's really not much further that these hospital systems have to go to buy up the rest of the market. We're seeing this in Arizona, where the major children's hospital is buying up all the pediatrics offices, and it's harder and harder to find offices that aren't part of that system. So, one thing that I think you mentioned, Brad, that's really concerning to me is how much these private and independent physicians and independent groups are struggling even to get the PPE, the protective gear, and get access, because the hospitals are controlling all of that market as well. And it's just kind of a scary sight, when really I think the data shows that had we had a good primary care system in place in this country, we could have really mitigated a lot of these issues by good quality primary care that could intercept people who were properly diagnosed with COVID and treat them at home, keep them out of the hospital systems, and avoid kind of what do they call the curve, right, that we were trying to avoid.
Yeah, I see that as one issue. The other issue I've been seeing too is just the lack of preparedness for the general population to use telehealth. Mm-hmm. And our members of Solidarity have had telehealth now for a year and a half. And we've seen our utilization rates go up with telehealth among our members because it's a safe place to call in. You don't have to go to an urgent care center or a hospital to get tested for COVID-19, but you can go get preliminary screened through the telehealth program, through a video conference or through a telephone call, and really keep the cost down, number one, but also keep the exposure down, number two.
Right. Well, and really have a chance to find out, what do I need? Maybe I'm okay, and walk through some questions. The CDC put out some really good questions of self-assessment to see if people needed it. And those tools, along with tools like with the telehealth, we talked to our telehealth, the company that provides telehealth for our members, and that we share into, and it was just amazing to look at. They're watching all the stats, they're paying attention statewide, in the area, and making sure what resources are available, and even we're able to point our members to the appropriate testing sites, in their area. I would love for you to share a little bit about what, locally here, and, we have some other providers around the country who are helping our members as well, but, some of the things we're doing with one of our providers here who's been able to treat, some of our members who have had COVID, and even a couple staff members here at Solidarity. Can you tell that story? Because I just love that partnership and what we're doing there.
Yeah, and I think this is what Solidarity is about as well, is how to find these local relationships at the lowest level, which is following the principle of subsidiarity. And I'm talking about a doctor, a naturopath here in Phoenix, and I was just here seeing him last week for another issue, non-COVID issue for me. And he basically said, Brad, I just want to thank you and Chris and Dr. Early at Solidarity HealthShare for allowing me to be a doctor. And I was like, well, that's fine, doctor. What are you talking about? He says, because you guys did interfere and tell us what we can and cannot prescribe. We were able to take our best guess on a lot of these issues, because it is a best guess when you have a new virus coming out, and apply principles we thought would work. And guess what, Brad? They worked. Yeah. And so that's what was beautiful. And so that's what we've been seeing and that's why I think what's really helped my anxiety or my fear, not only prayer and the relationship with the Lord on that, but knowing that I have this doctor that is open to help anybody in Phoenix that we send to.
Right.
So if you or me can get COVID, or somebody and even our employees that got COVID, that was the first call we made. And he was able to go to their house, get the treatment options available, and get them turned around in a couple days.
Right.
And I think that was a huge blessing, huge relationship, because for us, that's what this is about at Solidarity, is how do we restore the doctor-patient relationship again, and not have us at Solidarity or an insurance company or the federal government make a decision how to best care for somebody, but let's let the doctor and the patient decide what's best for them.
Right. Yeah, I remember the first patient he had that he was going to go see, who had tested positive, and he called up and said, "Hey guys, it's going to cost a little bit more, but I can send a mobile doc out, and they can do blood work there, and they can even do an IV bag to give some fluids and things." And we said, "Yeah, that's great." And he was so shocked, right, that we were able to do that. But that was all the better for that person who's a member and who was able to continue working through her treatment and recovery and working from home. So really important. One of the things as well, Brad, that I love is that a lot of our members work with certain providers around the country, and a lot of times we'll end up with a lot of members in that one provider office, and several of those physicians had started offering telehealth in their practice because they couldn't take as many people in the office and those things. And it was great to be able to have those offices call up and say, "Hey, is Solidarity going to share into telehealth visits?" And we said, yes, if they're already your patient and they're working with you and they're a member of Solidarity, we'll share into that. And that's been a really big benefit, I think, to our members, to make sure they could still get the care they needed from their physician, or in an acute situation from the dial care service that Solidarity instructs our members to use.
Well, that's the beauty of a health sharing ministry, because we can adapt to situations quicker than the insurance industry can. So would our member guidelines articulate what medical expenses are eligible for sharing among our membership, and we can ask for those to be changed. And that's exactly what we did through this COVID-19 issue.
Yeah.
Is how do we expand telehealth to make sure that our members have access to appropriate telehealth through dial care, the service we offer, or through their local provider. So we can adapt and adjust to these situations very quickly and adeptly.
That's awesome. Hey, so Brad, moving on from the coronavirus, which is really a temporary situation, and I'm so grateful that we have been able to respond well to our members' needs in this crisis, and I think it's been a big learning lesson for us as a team, and having most of our workforce we're working remote now. It's been a really good learning lesson. But moving on from that, I mean, what are some things that you foresee that Solidarity is going to, some endeavors we can take to give even more of that doctor-patient relationship, give back more of the primacy of that doctor-patient relationship? What are some things that, as we continue to grow and develop our program, that we're going to be doing at Solidarity to offer that? And then I've got a follow-up question to that.
I think that's a critical issue of our time right now, is because it's a natural matriculation of control in healthcare. So it seems like we've been inching closer and closer to, some type of socialized medicine concept. And some people don't realize that, but we have almost over 50% of our medical care that's delivered in this country is already subsidized or controlled by the federal government, between Medicare, Medicaid, the VA, and such like that. And so we're really talking about a very minority share of the market. It's estimated that the individual marketplace may be between 30 and 40%, which is significant in our country, but still we can act without control of the government. So with that being said, I think it's an education, number one, is how can we determine what's the best way to take care of ourselves and our person, through telehealth, through a wellness plan, a wellness program like Solidarity. But the thing is we rely on experts in the industry. And we go to a doctor, we expect the best treatment and the best, person there to help us. But the problem is who's controlling the doctors, the nurses, the hospital systems in this country. And I'll give you a classic example. When I went into the urgent care a few years ago for bronchitis, And the doctor says, well, you got bronchitis. We need to prescribe something to you. What insurance plan do you have? And I was like, it's irrelevant. What insurance plan do I have? I don't have insurance. Why are you asking that question? Oh, I need to know what medicine your insurance company will pay for this, and then before I prescribe it to you. And I said, no, that's not how we play this game, doc. I said, you make sure that you give me the best medicine, prescription medicine that's best for me and my body. And we'll worry about getting those medical expenses shared later. And he was like surprised by that. And so we got to be very careful not to handcuff these doctors into certain habits, certain behaviors, and do what's best for that. And I think that's going to come through education, by the members. But number two, it's going to almost take a quasi revolution here. Doctors are leaving the practice of medicine at incredible high rates right now. And so why are they doing that? One of the reasons is the burnout, is the lack of control to make autonomous decisions on their own. And so if we can get to those practitioners that are struggling, that want to have more freedom, want to get into healthcare like they did from the very beginning to help people, and I think that's the thing is this movement we're creating at Solidarity is the doctors are starting to join us now. Just like the example I gave at the COVID-19 with the doctors work with. Thank you for Solidarity for allowing me to be a doctor.
Yeah. I love it that just to build off of that, just recently, I think I told you one of our, physicians that we work closely with who, I think over time, he's promoted the program to his his patients as well. And I think they have 130, members of Solidarity in the practice, that are involved. And he requested a meeting with me, and I didn't know what it was about. And it was all because he wanted to make some recommendations to us about some things that he was doing to help Solidarity members, and then also a couple other physicians that were specialists that he really thought we should seek out to work with. And I thought, that's what I want to see, with us with our providers, is being able to be hand in hand and give them, the benefit of our relationship as well as the other way around, where we're working together and having these physicians who are recommending other specialists and providers that we can work with is such a gift. And I think that's what it's all about, right? This is a sharing community, and it includes the provider and the member.
Yeah, and I think that's something we've learned too, Chris, at Solidarity, is we got into this movement to protect, conscience protection, the conscience rights of individuals. So we wouldn't have to share in expenses like contraception, sterilization, abortions, right? But once we got into this industry, we realized how corrupt the payer system is in this country, with no transparency in billing, egregious overbilling, a lack of understanding of the free exchange of goods and services in the healthcare arena. That's what really got us even more upset than the conscience issues.
Right.
Yeah. And so for us, in order to have a plan that works for the members, we also have to make sure our Solidarity member guidelines also help the providers.
Right.
So if we truly want to overtake and follow the principles of the teaching of the Catholic Church on solidarity, subsidiarity, the common good, some virtues of truth and justice in practices, and avoid this rapid acceleration to socialism in our healthcare, it's going to take a unified effort. It's going to take a unified effort of the members, who actually receive the medical care, the providers, the good doctors who really want to give a fair and just wage for their care, for their services they provide. And then it's going to take a payer system like Solidarity to be willing to adapt and overcome. And by the way, since we're a not-for-profit and we serve the members, there's no profit interest like we see here in Arizona in the local paper, where one of the local executives just bought a $2.5 million mansion down the street. Those were those premium dollars that their constituents paid into there. Now it's going to a house for an executive $2.5 million.
Right. You mentioned, you kind of alluded to this here, but do you think that there's time for us to begin discussing, obviously you're certified in bioethics, you deal with bioethics issues all the time, and that's one of the reasons why you were so well fit to be a part of this Solidarity leadership team. But do you think it's time that we in this kind of Catholic medical world, this Catholic healthcare community, begin talking about the ethics of cost and how, our Catholic social teaching informs this egregious overpricing discussion that we're having?
Yeah, I think it's a fundamental flaw in our thinking. All right. So where do all the conscience violations come with abortion, contraception, and sterilization? It's mandated through federal and state governments through the insurance process. So let me get this right. So we have faithful Catholics and Christians throughout the United States giving money to a system that in turn is used to come at us, to violate our fundamental freedoms and conscience rights. And to me, that's very, very problematic. So I think there's a better model out there. So let's come together as a model of members coming together to form a community, to share the burden financially, but also share the spiritual aspect of healthcare. And how do we create a community to preserve and protect these conscience rights, the Catholic teach of the Catholic Church, and move forward to advocate? Because we got a long ways to go in this society before we stop this socialized medicine. And I think our members of Solidarity are going to have a key component to this. And so it's going to take them to be calling their congressman and say, hey, I want transparency in my billing. And we've used these examples before where we have a not-for-profit Catholic hospital, here in Arizona, that did a procedure for one of our members, and Medicare would have charged, $22,000, and this not-for-profit Catholic hospital charged this member $232,000, right? 1,100, 1,200% what Medicare would pay. Now, you think that's overbilling? I think that meets the classic definition of what overbilling.
I think that would in any other, if that was a gasoline price, the Attorney General would be bringing up that gas station on price gouging, right? I mean, anywhere else in the world, that would be called price gouging and is actually a criminal offense, right?
Yeah, but it's not, and I think that's the stuff we're going to see change. So as we grow and as we battle these transparency issues, how can we arm our members with valid information, like the Consumer Debt Collections Practices Act? And I'll give you an example of that. An agency, a hospital system, can't turn somebody over to collections if the bill is still in dispute. And so I'll give you an example. My son, after a surgery, had some complications, and we went to a different nonprofit Catholic hospital than what I just aforementioned. Basically, we got a bill for $8,000 for a 45-minute visit. Now, rest assured, we got good care in that 45 minutes, which is surprising. We're only there for 45 minutes, right? But if you look at it, they called and said, well, when are you going to pay this bill? We're not paying anything until you get an itemized bill. What did you do for this $8,000?
Right.
We're not just going to submit this to Solidarity for sharing. How do we know this is a fair and reasonable price, a fair and just wage for these providers? And so every couple of weeks they've been calling, and we've been saying, no, this is, well, you need to turn this, you need to pay this now. Otherwise, we're going to turn it over to collections. And my wife and I just say, listen, I said, this isn't a valid debt. You're overcharging us. This is still not undisputed. And so until you send us an itemized bill so we can see exactly how much it is, and if you turn us over to collections, we're going to file a lawsuit under the Fair Debt Collection Practices Act. And so we finally got an itemized bill a year and a half later, right? And so we submitted to Solidarity. That $8,000 bill was repriced down to $1,200.
Yeah.
And so now Solidarity on our behalf of our families going back to fight with that hospital and saying, no, fair and reasonable pricing for these 110 reasons is $1,200 on this bill. So that's the stuff we really need to be focused on. And until people get upset about this and say we've had enough, it's just going to go status quo.
Yeah.
And that's my concern as we see more of these hospital systems gobbling up these small providers. We have to turn that tide, not only for financial reasons, but for...
Right. Well, and part of that too is the further you divorce the provider from the charging for the healthcare, the further they are from that conversation, the easier it is to overprice. Because if I go to my doctor and I find out that he's, charging me 800 to 1,500% of Medicare, we're going to have words, and he doesn't want to have that conversation. But if he's not involved in the billing of the healthcare, it's really easy to just divorce himself and let it happen. Before we move on, I have one other question, and I think this is important for you and I to address this kind of thing, because I think one of the pieces that we're dealing with right now in Solidarity is our own systems and processes and how to improve them, so that not only are we prioritizing the doctor-patient relationship and making sure that we're paying fair and just pricing for healthcare, sharing that with our members, but we also need to make sure that we are adding some efficiency, right, and making sure that these dollars are, that we're facilitating for our members are moving quickly. So can you address some of the improvements that we're making at Solidarity to make sure that we're able to, share these bills in a timely manner and really help to kind of, fuel this conversation with doctors and patients, so that they're not worried about, it taking a long time, which has been a black eye for healthcare sharing ministries in general, and certainly Solidarity is not immune to that.
Yeah, I think we got to really work hard on, as an industry, with good systems and processes. And I think that's done through, number one, is through education of our members. But the thing I'm looking forward to is our provider databases. So the relationships we have now with our vendors that help us, determine what fair and just pricing is. It's the same company that Amazon uses and Home Depot uses. And so what we're going to be seeing this fall, which is launch, which will be great, is let's say I have a procedure I need done here in the Tempe, Arizona area. I can go online now. I can call our member care team here and to say, okay, give me a list of docs here in this area that do this procedure, or this type of specialty, and which ones are going to be fair and just pricing, or which ones are going to be gouges for pricing. When we first started talking about this concept, I called it the Santa Claus nice and naughty list, right? That's basically it is. Who's on the nice list? Who's going to give us fair pricing and who's not? So that's the first thing, is we have to empower our members and society with education. How much are these people going to be favorable to us, or are they going to really try to take advantage of us? Cash pay, self-pay, members of healthcare sharing ministry. That's the biggest thing I see. The second thing I think you'll see too this fall is right now every single bill that's processed, and last year we had over $40 million worth of medical bills submitted to Solidarity HealthShare. We were able to get those repriced by 58%, and so our members had to share in $18 million worth of medical expenses. But the problem with that system on our old software is every single one of those bills had to be personally vetted by somebody. Now with technology, with the claims and adjudication system we're going to be implementing this fall, is we will be able to what they call auto adjudicate these bills. So the computer we can set up parameters in the computer. If we have this procedure and if it's in this price range that we determine would be a fair and just price based on certain standards, the computer will automatically approve it and send it off for processing and sharing among our members' medical bills. That right there is going to expedite the processing of the medical bills tremendously.
Right.
And I think we're seeing this movement right now, especially in health sharing ministries, to pull something like that off.
And it's exciting in that system as well that not only will be able to, continue vetting certain procedures that need some ethical reviews and making sure that certain things don't go through, but also build that into the system so it'll catch anything. Let's say that there's an abortion procedure or something, those things would get stopped immediately and either kicked out or in the case of a hysterectomy, go through an ethical review to make sure that it's according to Catholic bioethics. And that is such an exciting piece that we'll be able to speed things up, but also make sure that on the front and the back end, we're doing the proper vetting to not only make sure it's fair and just, but also that we're matching the standards that we uphold, which is the teachings of the Catholic Church, and that's such a great improvement. I'm excited, Brad. Our partnerships with some of the different provider communities out there who have been advising us and giving us guidance on some of these things that we're going to be able to add into that system and systematize that process so that we can just focus on really advocating and educating our members.
Yeah, and that's what we need. We need to create a movement of self-pay, cash pay patients that can reverse this course towards socialized medicine, where we have educated members going into a transaction where a good and a fair amount of goods are exchanged for a service, in this case, at a fair and reasonable price. And then how do we protect our members through the process? And number one is, how do we work with Congress and at the state level to make sure that these are protections along the way? Because there's going to become a time in health sharing ministries where they're going to be further under attack based on our religious views. It's a natural progression in the history of the world where we have governments that gradually start fighting with religion. And we've been seeing this a lot. And we first saw it with the Affordable Care Act with the mandates. Now we're seeing a reprieve under the Trump administration, who's done a great job for life and also to help nonprofits. But now we're going to see a return of that, where conscience violations are going to be, how can we constitutionally, legally protect our members of Solidarity so we have the right to have fair and just pricing in medical care, where we pay for things and share for things that are not morally objectionable.
Right. Well, this is great, Brad. It's great to have a forum to be able to share some of the ideas and things that we're working on every day, and the leadership you've provided, the work you're doing in the policy space, and also with the other healthcare sharing ministries to help kind of drive some of these initiatives. It's been really incredible. So as we come up on our fourth year of being publicly available as Solidarity HealthShare, congratulations, we're here. And I'm so excited about what's to come, Brad. I think we've got a lot of great things. And I want to encourage our members, to continue to watch as we roll out some of these new systems and as we roll out some new opportunities for them to engage online with each other, but also to keep keep in touch and let us know what you're seeing out there. And we have a lot of great resources coming your way to help you at the counter with your provider and help you continue to live this healthcare journey. So thanks for joining us for Straight Ahead. I'm excited to continue this series, and this next couple of weeks we have several guests that we're excited to bring you, and we'll continue this month of May this conversation on price transparency and healthcare in America. So thanks for joining us, and please leave your comments in the box below, and we'll see you next week. God bless.